I'm Lexi Gordon. I want to apologize for not being with you in class today. I have received special permission to miss class for extenuating circumstances, for which I am grateful to be excused. For our behavior change model, we chose to use the health belief model to help motivate our client Arthur to make positive behavior changes. It was designed by Hochbaum, Rosenstock, and other social psychologists in the 1950s to explain why individuals were failing to participate in programs that had been designed to prevent and detect diseases. The model was later expanded by others to understand human behavioral responses to different health-related conditions. We chose the health belief model because studies have been done to show that lifestyle changes that include increased physical activity, stress management, and dietary improvements play a significant role in secondary and tertiary prevention of coronary artery disease. The health belief model has been successfully used in patients who have coronary artery disease, make positive changes that have resulted in a 47% improvement in case fatality rates. Let's take a look at how the health belief model works. Here we see a diagram of the different steps of the health belief model and how they work together. Let's quickly look at each part. Notice that modifying variables is in green and points toward perceived benefits and barriers, perceived threat, and self-efficacy. These components of the health belief model can be influenced by internal or external factors. Perceived seriousness and perceived susceptibility both influence the client's perceived threat. Any one of the next components can lead to the likelihood of the person engaging in health-promoting behavior. The more components that point toward change, the more motivated the client will be to participate in the health-promoting behavior. If the person perceives that the benefits outweigh the barriers, they are likely to start making changes. If the perceived threat is bad enough, that could also lead to positive changes in behavior. A client with high self-efficacy who believes they are capable of following through with the changes are more likely to engage in health-promoting behaviors. Often, the client will have acute action that spurs them to make necessary changes. Again, the more components the client has pointing toward positive change, the more likely they are going to be to succeed in engaging in health-promoting behavior. Let's see how this applies to our client, Arthur. Perceived susceptibility is how much a person believes that they are likely to get or be affected by a disease or a condition. Arthur is somewhat aware that he could have a heart attack. He's afraid of exerting himself too much and triggering this heart attack. Both Arthur and his wife are afraid that he will die if he exerts himself too much. This has prevented them from being intimate together and has stopped Arthur from walking to his favorite fishing spot, limiting his exercise and physical activity. Perceived severity is the individual's belief about how bad or serious a condition really is. Arthur is slightly concerned about dying and leaving his wife and two college-age children to fend for themselves because he is the primary care provider. Perceived benefits describes how much the client believes that making positive health changes will affect their condition. Arthur does not see the benefits of changing his lifestyle and thinks that when it's his time to go, it's just his time to go. Perceived barriers address the client's own evaluation of obstacles that they face to make changes. He seems to believe that the surgery should have fixed everything and he should be fine now. This belief further discourages him from wanting to make any lifestyle changes. Arthur has tried to quit smoking in the past unsuccessfully, so he believes that it is impossible for him to stop now. He drinks 2 beers every night to help himself relax. Arthur does not currently believe that the benefits outweigh overcoming the barriers that are in his way of implementing healthy change. Cues to action are factors that influence the decision to make change. In Arthur's case, he felt the test required for him to go back to work. He needs to be able to lift at least 75 pounds and walk around the train yard, as well as be able to climb up and down the train steps, which he is not currently strong enough to accomplish. He is also motivated to provide for his family, which consists of his wife and two college-aged children. Self-efficacy is the individual's confidence in their own ability to consistently engage in the health-promoting behavior. Due to Arthur's previous failures at quitting smoking and the lack of desire to change, he currently has a low self-efficacy that he will be successful at making necessary health changes. Let's watch how this plays out in a discussion with Arthur and his therapist.